As we get closer to the fall, Austin's top doctor is warning we may not be ready for UT football games or some of the back-to-school plans in the works. There are concerning new trends with young people and COVID-19. KXAN's Jacqulyn Powell breaks down his latest recommendations presented to Travis County Commissioners today.
An alarming trend from Austin Public Health, a rising number of COVID-19 cases in young people ages 10 to 19, with more than 10% of positive cases in the area now coming from those children and teenagers.
It's likely to be happening because the school-age children are interacting over the summer.
APH is watching those cases closely, working against the clock to learn more about how children transmit the disease before schools open.
So there are young kids who are being hospitalized. We're seeing cases of school-age children having died in other parts of the country. Again, luckily that those percentages are very small, and we expect that they're going to stay small, but they are not going to be zero.
That's why APH plans to recommend that schools operate at no more than 25% capacity in person at first.
It's essential that when schools open, they open with a small number of students to help revise and refine the processes that the schools are going to undertake for this.
And speaking of big undertakings, like UT football games that the university says will be played in a half-full stadium.
I think it's not really living in the realm of reality for what we're likely to experience this fall. Quite frankly, I think it's going to be a struggle for us to even allow teams to play on a field without the crowd.
Jacqulyn Powell, KXAN News.
And Dr. Escott says college football games would create a need for coronavirus testing of everyone involved before each game. He says when it comes to schools, increased testing will be needed there too. The county is currently in the process of asking the state for help with testing capacity for schools, similar to how the state helped provide tests for nursing homes.